So good morning everyone, I'm Katrina Bautista from Level 3 and 3B. And I'm going to discuss all about emphysema. So what to learn in this video, we are going to learn about the cause of emphysema, its signs and symptoms, how it is diagnosed, what are its risk factors, and what are the treatments. So what is emphysema? So emphysema is a disease of the lungs that is usually developed after many years of smoking. So emphysema belongs to a group of lung disease that is usually known as chronic obstructive pulmonary disease or COPD. So once it develops, emphysema can be reversed. This is why avoiding smoking or stopping smoking is very important. So emphysema involves damage to the walls of the air sacs or the alveoli of the lungs. So alveoli is a small, thin-walled, very fragile air sacs that are located in clusters at the end of the bronchial tubes deep inside the lungs. So there are about 300 million alveoli in the normal lungs. So as you can see in the picture, we can see here the normal alveoli, and here naman po is we can see an alveoli with emphysema. So when emphysema develops, the alveoli and lung tissues are destroyed. With this damage, the alveoli cannot support the bronchial tubes. So the tubes will collapse and cause an obstruction, which traps air inside the lungs. So pag marami ng air ang natrap sa lungs, it can give some patients a barrel-chested appearance. Also, because there are fewer alveoli, less oxygen will be able to move into the bloodstream. So what are the causes of emphysema? So the main cause of emphysema is a long-term exposure to airborne irritants including tobacco smoke, marijuana smoke, air pollution, and chemical fumes and dust. So what are its signs and symptoms? So first we have shortness of breath, ongoing feeling of not being able to get enough air, a long-term cough or a smoker's cough, wheezing, long-term mucus production, and ongoing fatigue. So how it is diagnosed? So the diagnosis of emphysema cannot be made slowly on symptoms. So need ng several tests para ma-diagnose kung may emphysema ang client. So we have this one simple test. It is to tap on your chest and listen with the stethoscope for a hollow sound. So if there is a hollow sound, ibig sabihin nun, there is a trapping of air inside your lungs. So meron tayong other tests to include like X-ray that is generally not useful sa pag-detect ng stages of emphysema, pero they can help diagnose moderate or severe cases. Next is pulse oximetry. So this test is also known as an oxygen saturation test. Pulse oximetry, ginagamit to measure the oxygen content of the blood. So this is done by attaching the monitor to the client's finger, forehead, or earlobe. Next is spirometry and pulmonary function test or PFT. So this is one of the most useful tests to determine airway blockage. A spirometry tests the lungs volume by measuring airflow while the patient inhales and exhales. So this test is done by taking a deep breath and then blowing into a tube that is hooked up to a specialized machine. So these tests are compared to normal results from people of similar age, height, weight, and ethnic background. So next is we have the arterial blood gas or the ABG. So this test measures the amount of oxygen and carbon dioxide in the blood from an artery. So it is a test often used as emphysema worsens. So sobrang helpful nito to determine if a patient needs more oxygen. Lastly, we have the electrocardiogram or the ECG. So ECG check heart functions and are used to rule out heart disease as a cause of shortness of breath. So who can get emphysema? So pulmonary emphysema occurs usually at 60 to 80 years of age and is defined as being early onset when the disease develops before 55 years of age. So here are the factors that increase the risk of developing emphysema. So first we have smoking. So emphysema is most likely to develop in cigarette smokers. but cigar and pipe smokers are also susceptible. So the risk for all types of smoker increase with the number of years and amount of tobacco smoke. Next we have is age. So lung damage that occurs in emphysema develops gradually. Most people with tobacco-related emphysema begin to experience symptoms of the disease between ages of 40 and 60. Next we have is exposure to secondhand smoke. So it is also known as a passive or environmental tobacco smoke. It is the smoke you inadvertently inhale from someone else's cigarette, pipe, or cigar. So being around the secondhand smoke increases your risk of emphysema. Next is occupational exposure to fumes and dust. So if you breathe fumes, certain chemical or dust from grain, cotton, wood, or mining products, you're more likely to develop emphysema. So the risk is even greater if you smoke. Lastly is exposure to indoor and outdoor pollution. So breathing indoor pollutants such as fumes from heating fuel, as well as outdoor pollutants like car exhaust, increase your risk for emphysema. We have a question here. Can you get emphysema if you never smoke? The answer is yes. You can get emphysema without being a smoker, but cigarette smoking is by far the most dangerous behavior that causes people to develop emphysema, and it is also the most preventable cause. So what are the treatment for this disease? So emphysema can worsen over time and wala pa siyang cure, pero may treatment na siya that is focused on slowing the speed of the decline. So yung type ng treatment is nakadepende kung gaano ka-severe yung disease. So first we have is, this is the most important step that you can take to protect your lungs, and it is never too late to quit. So pwede kayong mag-ask sa inyong doctor to help you find the best quitting method for smoking. Next we have is the bronchodilators. So this medicine relax the muscles around the airways. So bronchodilators is given through handheld inhalants. Nagpo-produce sila ng mas mabilis na result, and they have fewer side effects kaysa sa oral medication. Next we have is the anti-inflammatory medication. This medicine will reduce inflammation in the airways. Pero yung drug na to is meron siyang long-term side effects that include osteoporosis, hypertension, high blood sugar, and fat distribution. Next is the oxygen therapy. So it is prescribed for patients whose lungs are not getting enough oxygen to the blood. So yung patients na need ng oxygen therapy is yung mga di na kayang maka-absorb ng enough oxygen from the outside air. Lastly, we have the lung volume reduction surgery. So the lung volume reduction surgery involves removing a portion of diseased lung tissue and smoking. So every time na you smoke a cigarette, you relieve the pressure on the breathing muscles, and pwede din siyang maka-help to improve lung elasticity. So yung result ng surgery is very promising, pero not all patients with emphysema are candidates for this surgery. So how to prevent getting emphysema? So first one we have is don't smoke or stop smoking. So every time you smoke a cigarette, nag-inhale tayo ng thousands of chemicals sa ating lungs, including nicotine, carbon monoxide, and tar. So these toxins damage your lungs, and they increase mucus, make it more difficult for your lungs to clean themselves, and nag-i-irritate sila and nag-i-inflame ng tissues. So gradually, your airways narrow, making it more difficult to breathe. So no matter how old you are or how long you've been a smoker, quitting can help. So according to ALA, they states that within just 12 hours of quitting, the carbon monoxide level in your blood drops to normal. And then within a few months, your lung functions begin to improve. And then within a year, your risk of coronary heart disease is half that of a smoker's. And it only gets better the longer you stay smoke-free. Your lungs steps up their activity to deliver that oxygen. It's avoiding cigarettes. Getting regular exercise is probably the most important thing na pwede natin gawin for the health of our lungs. Just as exercise keeps your body in shape, it also keeps your lungs in shape. So when you exercise, your heart beats faster and your lungs work harder. So your body needs more oxygen to fuel your muscles. Your lungs steps up their activity to deliver that oxygen while expelling additional carbon dioxide. Next is avoid exposure to pollutants. So exposure to pollutants in the air can damage your lungs and accelerate aging. So when your lungs are young and strong, they can easily resist these toxins. But as you get older, they lose some of that resistance and become more vulnerable for infections and disease. That's from First we have is avoid secondhand smoke, avoid exercising near a heavy traffic, take all possible safety precautions. Next is in indoors, make sure your home is a smoke-free zone, dust the furniture and vacuum, avoid synthetic air freshener, keep your home clean, and use natural cleaning products. So, the best way to avoid lung infection is to keep your hands can be particularly dangerous for your lungs, especially as you age. So, the best way to avoid lung infection is to keep your hands clean. So first, we have to wash regularly with warm water and soap. And avoid touching your face as much as possible. With your vaccination. So get a flu shot each year, vegetable. So they contain nutrients that help boost your immune system. Using only a small portion of your lungs. Get a flu shot each year, and if you're 65 or older, get a pneumonia vaccination as well. So, of course, the best way to prevent is by people. You take shallow breath from your chest area using only a small portion of your lungs. So deep breathing can help clear the lungs and create a full oxygen exchange. To try it yourself, sit somewhere quietly and slowly breathe in. Agree that breathing exercises can make your lungs more efficient. So to try it yourself, sit somewhere quietly and slowly breathe in through your nose. Then breathe out at least twice as long through your mouth. So, for example, as you inhale, count 1 to 4, and then as you exhale, count 1 to 8. So, of course, the best way to prevent is by giving your lungs a break. So, as I've said, avoid smoking and do exercise regularly. Emphysema. Thank you for listening.